through this presentation. So if you have something that you would really like to ask, it's burning, you want to get some clarification, feel free. You can jump right in and be a part of the conversation. So there's that. Also wanted to let folks know that this is being recorded. So if you have friends, colleagues, others that are missing it today, there'll be an opportunity for them to watch this later. But let's see. Also, it looks like everybody's doing a great job. We've got a lot of Zoom experts on here today. I see most people are muted. If you're not speaking, to help us with the feedback, hit that mute button. We might have to do a couple of reminders. Also, during the course of this, and we're not going to interrupt the flow of the conversation today, you're going to see some poll questions pop up, okay? And so just answer those questions, and then we're going to get some real-time results of those. There's like 3 of those that are going to be coming up. It's mainly just to let us know who you are, why you're here, what you do, and what county you're from, that type of thing. So again, just if you don't mind, click on those things. That'll help us out. All right, well, that's about it for the housekeeping portion of it. And once again, thank you for joining us today. And I'll turn it back over to Jerry to get things rolling.
Again, welcome to everyone. I'm really excited. We've got a great group that'll be speaking, but as Jeff mentioned, it is meant to be interactive. So follow Jeff's directions if you want to engage and have questions for the group. So with that, our first person to speak today is Jessica Wall. And I'm going to allow her to introduce herself because I don't feel for any of the people I've got, I can do it justice to what they can do. So welcome, Jessica.
Thanks so much, everyone. Good morning. My name is Jessica Wall, and I'm the Assistant Director with the Yadkin County Human Services Agency. Yadkin County does have a consolidated human services model with health and social services. So I'm the Assistant Director on the health side and have been with the county for 11 years and in my position for 8.
And Jessica, we've over the years had many conversations about the mission of your department and how you all are always looking for opportunities for collective impact. Could you talk to the group more about how collaboration and coalition work is important for local health departments, and really how this helps you further your mission and create opportunities for collective impact?
Sure, glad to do that. Thank you for the opportunity to share. So hopefully everybody on today's community cafe has had an opportunity to work in some capacity with their local health department. As you all are probably aware that have worked with local public health in North Carolina, we're tasked with the ongoing role of and work of knowing what the needs are in our community, health needs, but overall needs, all those things that can have an impact on a person's health status, if that's transportation, food insecurity, substance abuse, mental health, those things that, those social determinants of health that play into who they are as a person and how they can adequately handle their health and well-being. So those are things that, we care about as a local health department, what the data says and what our community is telling us are the needs. And then local public health, really too, we in Yadkin County and across the state, we find ourselves studying those things and asking ourselves questions like, what can we do to tackle some of the things that are going on in the community? What's already happening in the community? What partners are already there? What agencies are already there? It doesn't necessarily have to be that the local health department sees there be a problem and then immediately, totally in and of themselves, develops that intervention. And health departments are really encouraged to, and I think do a really good job of building partnerships with agencies in the community so that we could collectively come together and say, these are the things that are going on, what's already here that we could do more with, or that we could connect the dots on. And occasionally you may find yourself in a community where you've identified an issue because maybe it's new, or maybe it was kind of in the background where there's not a program. And so this is really where I think that coalition and collaboration in a community is really going to drive a public health department's mission further. You all are helping us, right? We're working together. It's not just us sitting at the health department, crunching data, looking at the numbers, and then picking an intervention from the shelf and putting it in place and then moving on. That's really not what the intention is supposed to be about. We gather power and strength in our numbers and in our partnerships and our relationships. And then, of course, through that process, then each individual agency that participates is able to sort of, further their own mission as well. Let everybody know about the programs they have and the services that they have available. One example that I like to use when I talk about coalition work in Yadkin County recently, every health department, you all are probably familiar with the fact that we are asked to do a community health assessment or a community health needs assessment, depending on if your county has a hospital. And with that, we're told, study what's going on in your community. Look at that secondary data around death and substance abuse and cancer, nutrition, some of those other things, but we're also asked to survey our community. In Yadkin County, we used our coalition as our community health assessment task force. They helped us develop the questions, where to ask the questions, who to ask the questions to. They helped us look at that primary data. And as a team, we looked at the primary and secondary data and decided what we felt like were the top issues in our community that we really wanted to spend the next 4 years working on. So again, not the health department working in a silo, looking at data and deciding the problems, that as a team. So we're all bought in on, we want a healthy Yadkin County. We want health and wellness for all those. What's keeping us from getting there? And then that allows us to study the next step. So for a health department, that's a community health improvement plan. Again, not something we need to sit in a room by ourselves and develop. We need to be at the table with our partners, collaborating and saying, okay, everybody, these are the things that we have set as a team, our problems that we want to address. These are the things that we think are going on in our community that are keeping us from being our best self. What interventions are out there that can help us move the needle? Okay, making us kind of ask those questions. And again, like I said, it could be agencies that are already doing the work and we're able to lift it up and shine the light on it together, or maybe there is something new that you can put in place and you do it as a team again, and you've got all that buy-in. So that's how us as a local health department kind of studies need. And we're really encouraged, and we want to step out of the building, right? Get out into the community and form those partnerships, because we can further everybody's mission and then move the needles on some of those data points that we're studying. Does anybody, turn it back to you all if there's any chat around that or any questions anybody has?
Well, Jessica, I'm not seeing anything coming in from the group yet.
Sure.
Yeah, we'll encourage folks to do that. And just another little housekeeping piece, we will have some time at the end, because I know that some folks are going to listen to the different presenters today, connect some dots, and probably have some additional questions at the end. But Jessica, while we still have you, I wanted to ask kind of a follow-up question. Could you talk a little bit about how you've been able to leverage the community to get testing and vaccines done in Yadkin County?
Sure. So again, I think it's the partnership piece of that is really important too. So well, at the very beginning, we could have let them come to us because there were a lot of people that really wanted to be vaccinated, but we're not going to do that. We're going to get out into the community and let people know that, what we have available. We don't want to take for granted and sit back and just think, well, everybody knows what we've got. Everybody knows where the testing's at. Everybody knows where the vaccines, how to get the vaccine. Again, having formed relationships, I think in Yadkin County, because we are more rural and a little bit of a smaller community, having done a lot of this coalition work and collaboration and sharing across partnerships, we've got faces and names of agencies. And I think that people in the community know the health department's doing testing and the health department's got vaccine, or if they're not the one doing testing, they know where to get it. And they know where to come in to get the information, but then us too, myself as an assistant director and our preparedness coordinator and our testing and vaccine teams are able to call upon agencies and say, this is a demographic we're looking at. This is a population we're wanting to work with. I can pick up the phone or I can email the executive director of our networks and say, we're really trying to reach our Hispanic population. Here's what we're putting together. Do you think it's culturally appropriate? Would you give us feedback? Will you help us form those relationships? And it helps us get, almost like putting kind of like our fingers out into the community where we can get feedback into to say, You need, maybe there's certain areas that you need to approach, or, make sure that your materials are at the right grade level and the right language. And I think we all have an understanding, or should be at a place, I think, where we know we're not all perfect, and we can be made better, and we can be made better through our relationships. And that's exactly what we did for our testing and our vaccine, just making sure that the people we work with, like the folks listening in today, are knowledgeable. Then you all become, our hands and feet and voice also. So now you're at meetings and you're in communities and you're telling people, well, this is what Jessica, the health department, told me about testing, or this is what Jessica, the health department, told me about vaccine. And if you think about it, that was the topic of the past 6 to 12 months, but that could really be true and be said for lots of different topics, right? If you're sitting at a table and you're saying, I'm really concerned about the number of children in foster care, or I'm really concerned about the number of children who, child abuse or elder abuse. And then you've got a face in a relationship, and you can say, well, I was having a conversation with Marlena Riley, who's our RPS supervisor, or Jessica Wall, in regards to family planning services or maternal health services, prenatal care. This is what she was telling me. And then by having those relationships and knowledgeable folks in the community, again, furthering that mission, collective impact too, in regards to all being on the same page at the same time. I hope that was helpful.
Yeah, Jessica, and thank you so much for that. And obviously, for folks being that are a part of this conversation today, if you haven't had a chance to get to know the people at your local health department, and you're starting to think about collaboration and coalition building, or you're already involved in some of those activities, reach out, get to know those folks, because as you can tell, there's just a wealth of information about all things health. So
right.
I talk to Jessica pretty regularly, and it's like a treasure trove of health information. The other thing that before we move to our next panelist, that I wanted to bring up is health departments do a remarkable job at taking complex health topics and making them understandable. And for the community, and for folks like us who are other stakeholders in that need to understand these things but may not be medical professionals. So Jessica, thank you so much for sharing that with us today.
Absolutely.
And we also had a poll question come up, so I'm going to go ahead and share the results of that just so folks can see who's on the call. And as you can see, we've got a bit of a mix. So it's almost neck and neck with the MCO folks and providers, and we have other stakeholders, family members, and other. So that's a good cross section. I'm not surprised by that one, but I feel like, again, we've got a lot of folks on here who will be doing some cross pollination with each other. So thank you, Jessica. And Jerry, I'll turn it back over to you.
And I actually have the easy job. I just get to welcome each of the participants that are going to be speaking. So next up is Mark Willis. So welcome, Mark.
Good morning, Jerry. Good morning, participants.
Mark, why don't you tell us a little bit about yourself? It's just a short introduction.
I am Surrey County's Director for Substance Abuse Recovery, kind of an anomaly, at least in this state, where our other guest speakers are in specific organizations. I have my own department, and I report directly to the county manager, and then I'm accountable to the county commissioners.
So, Mark, it sounds like you have a lot of bosses. Would that be accurate?
No, actually, on a day-to-day basis, I talk to one, and that's the county manager and the county commissioners, who agreed and collaborated with the director of the Health Nutrition Center in Surrey County to create this position and fund it. They oh, and thank you very much. I'll give a head nod to partners who also provided some of the seed money for that. I report to them on a quarterly basis, and my door is always open to them. But I get most of my my daily direction from the county manager.
Well, Mark, thank you for that. And for the group, in the past several years that I've uh, the privilege of getting to know Mark, much like has been the situation with Jessica, we've had a lot of conversations. And many of those in the work that Mark's doing in Surrey County, they all kind of lead back to how are we going about collaborating? How are we doing this coalition building? Because it's a really big task that Mark's leading the cause for. So recently, Mark, you all were awarded, not ordered, awarded a federal grant. And you and I talked a lot about some of the needs in Surrey County, and over and over and over, you've talked about the need to be using and utilizing data to make good choices. And when the time came and you were able to get this grant, one of the things that you did was go ahead and secure monies to hire a data analyst. Could you talk with the group a little bit about your reasoning and justification for adding a data analyst to your team to help you with the work that you're doing?
Sure. I'll go back into history. I'll go over 100 years, over 100 years ago in 1904, Baltimore City had a huge fire. And despite the fact that 1,200 firefighters and from 9 different cities showed up, they stood there and watched the city burn. And something like 1,300 buildings and 2,500 businesses were destroyed. And it was a data analyst. His name was Albert Merrill, came from the National Bureau of Statistics. He on his own undertook a study and found out that fire departments across the country used over 600 different gauges of pipes and hoses, and almost none of them matched. So, which ended up being creating a standard across the United States for these connectors. Well, and his conclusion was there was no lack of equipment, manpower, courage, fortitude on the part of the firefighters or Baltimore City to try to stop this fire. What they lacked was imagination. No one ever thought that a fire of this dimensions would hit a city like Baltimore. And it's really what is affecting our own county here, that no one ever thought that a epidemic, that's what we're calling it, I don't like the term, but an epidemic of substance use that caused so many overdoses and so many deaths in the last decade would ever occur. So we have no lack of courage, fortitude, dedication, and manpower in this county to try to address our substance use problem. What we're lacking is imagination. And what I needed was data and metrics to show agencies that what they're doing and how they're impacting the problem. So let's go now from Baltimore City over 100 years ago to Surrey County. So I asked myself, after I asked the commissioners what they expected of me, and their guidance to me was that the number 2 problem in this county was substance use, and affected everything everyone did. Every agency, certainly in the county, and many of the businesses. And it affected their number 1 problem, which was the budget, money. So they said, please help us find the problem. Please explain it to us. Please bring solutions to the table and we'll help you implement them, which is fantastic. It was fairly broad, but I like to work like that. But the first thing I figured out after about 200 some interviews, people across the county, and asking them what was their measure of success to quell this problem we all had different measures of success. My personal measure of success, when I looked at it, was, well, okay, if we know, and this is true here and it's true nationally, that 80% of our crime problems in this county are predicated on acts that are meant to fuel substance use. And if 80% of our domestic violence problems are predicated on substance use, and 2/3 of our child neglect and abuse problems are predicated on substance abuse, that there's a population that's doing that. What's the size of that population? Does anybody know in Iredell County or in Yadkin County or in any county for that matter, what that population is, since they're causing all the problems? Well, I would measure success by decreasing the size of that population, by guiding that population and connecting it to treatment so that they become productive citizens. But we'll never know that. We could take a wild guess at what that population is, but we'll never know what the number's in. So how do I say there's 3,500 this year and next year it's 3,000? See, we're doing a good job of getting people into treatment. I'll never be able to do that. So, but if we do know those crimes and foster families and substance abuse and 50Bs that are issued by magistrates, and we know those numbers, we could probably say and conclude that what we're doing to get people into treatment and to connect them and make them healthier, when the hepatitis C rate falls and the crime rate falls and the incarceration rate over at detention center falls, we may be accomplishing something, because that is indicating that the substance use population is getting smaller. That's all data. And I don't have the schooling nor the brains to be able to do that. And the data that was coming from the state and the national level was insufficient to convince the leaders in this county that they needed to do something different. And in fact, some of the things they were doing were negatively impacting other agencies. And probably Jessica wouldn't disagree that some agencies in her county are doing things that are making her population more unhealthy rather than healthy. And that in some cases are what's happening here. So I needed to collect local data on specific things like hepatitis C and specific crimes that are predicated by substance users in order to fuel their addiction, and put all those together. And then I needed to be able to do a lot of things that would positively impact our health, make us healthier, and reduce that population of substance users positively, and then chart them so that everyone could see them. And essentially you get one graph that shows all the bad things are going down and other graphs that show all the good things are going up. And that's simplifying it, but I needed a data analyst to do that.
Mark, that is what you've done here is you've really started to connect the dots. So I'd like to think it was Jerry's masterful way of putting together an agenda. However, I think that it's flowing this way because you can see Mark is starting to show how the linkages to health. Mark mentioned hepatitis C. He mentioned other health problems, things that health departments are very, very active in and tracking those things. He's looking at social drivers of health, all of those pieces. So, and able to pull all those together, Mark was really looking at how can we know then, once we have those, are the things that we're doing to intervene helping, and or in some instances, are they making it worse? And how are we going to know what to keep doing more of and what to discontinue in terms of our interventions? So Mark just pulled together some of the public health piece and really made a nice segue into our next guest speaker. So Jerry, would you like to take over and lead us into our next speaker?
Sure. And yeah, just love the way Mark kind of tied in what Jessica did. So we're going to take a little different look at it and add another component to it. And I'm going to welcome Tercusia Brown Evans to join us now and tell us a little bit about yourself and who you work with, and then let it roll.
Well, thank you so much for inviting me here. And my name is Tercusia Brown Evans. I am a community resource coordinator for South Statesville for the Statesville Police Department. A little bit about me, about 23 years ago, I started out in early intervention. And then I quickly transitioned into mental health and behavioral health and stayed there for quite some time. I've worked in day treatment. I've been over residential facilities, level 4 facilities, psychiatric facilities, and I've done case management for workforce development programs as well.
So as you all can tell, Tercusia comes with a wealth of behavioral health background and knowledge, and is now again working with the community and community policing, and in particular working in the South Statesville area with the Statesville Police Department. So thank you again for being with us. But talk to us, Tercusia, about how collaboration and coalition building is important in the work you're doing with community policing.
Well, I will say that about a year ago was when I transitioned into law enforcement. And if you haven't ever worked in law enforcement, it is an eye-opening experience. It's a challenging place to be, frustrating, but in a good way, because you feel like, okay, well, I'm learning something new. I'm developing in areas I didn't know I need to develop in or grow. And so one thing our chief of police, Chief David Addison, did, he's been in his position about 2 years. He noticed when he first came into his position that law enforcement was responding to calls, 911 calls. They were going out, and really they were dealing with those social determinants versus enforcing the law. So those housing needs, resource needs, food, lack of resources, things of that nature, that were sometimes crossing over into those 911 calls. So he said, okay, we need to step back and we need to look at how we're policing the city of Statesville. So a little logistics for Iredell County. So if you're looking at Iredell County as a whole, you're looking at around 180,000 individuals. But Iredell County is broken out. You have Mooresville, Troutman, and Statesville. So when I'm speaking of the city of Statesville and the Statesville Police Department, it's about 28,000 individuals within the jurisdiction of the police department. So he said, we need to start looking at how we're going to police in a different way. So that's where you have the community-oriented policing. And that's really based on relationship building, establishing those partnerships with the service providers, the resource providers, the nonprofits in the community, community members, faith partners, and really looking to collaborate and looking to build that trust and into where the community members are willing to work with law enforcement, because what you typically get is that mistrust. And so if something happens and the community sees it, okay, it's a law enforcement issue, so we're not gonna step in. However, if you have that rapport and that relationship, then they're more likely to talk about and discuss what the issues are and the concerns are, and to help collaborate to come up with a solution. A part of what came out of the community-oriented policing was the Community Services Division, which I am a part of. And we have another CRC as well. We have a crime prevention officer, and then there are officers, and then the sergeant of the division. The crime prevention officer provides the education, the training. He works in the school system, works within businesses, does active shooter training, internet safety, drug awareness. We even have an opportunity for individuals to participate in simulations, to where they get to be interactive and they get to wear the goggles and they get to experience what it's like to be impaired, if you can't quite see with the, the blurry vision from alcohol. So there's a simulation component as well. Another piece of that that's actually coming to the area soon, it's not here yet, is the child ID system. So businesses and nonprofit organizations will be able to call the Statesville Police Department, and the crime prevention officer can come out and set that site up for doing child IDs. So that's something that's in the works that will be open to the community soon. COVID actually stopped the Citizens Academy, which is a great opportunity for those who are too old for the Explorers program, because you do have to be 18 and there are some stipulations for the Citizens Academy, but it's an actual 8-week course where you meet one time a week, 3 hours that day for 8 weeks. And you get to learn about investigations, patrol, the community services division, the K-9 unit, the special response team, and which used to be called the SWAT team. It's now the special response team. So really looking at the basics of what it means to be in law enforcement, looking at use of force, looking at the laws, looking at the policy. So if you want to know just a general idea of what it is, what law enforcement is about, the Citizens Academy is a great opportunity for that. And then we actually just finished up yesterday, but another part of that is the CIT training, the Crisis Intervention Team training. And we had our first class, ended yesterday from COVID. It was, off for the COVID restriction. But that is a 40-hour training where it gives the tools and the resources to the officers, to the first responders, EMS, the sheriff's deputies, probation, 911 operators, anyone who may come in contact with someone who is going to be in crisis, and gives them tools and resources to reach out to connect with. And it also gives them interventions and different ways to respond with empathy in situations versus always going to, yes.
Keisha, it's perfect timing. We just had a question come in about CIT. And of course, Tercusia was at the CIT graduation yesterday. It was Pam Navy, Jeannie Patterson, and Amber Matthews, who are also on the call. I see Kathy Perkins is on here, who has also been involved in CIT in the past. Well, and Jeannie just answered the question and jumped in a little bit. And there was a question about cahoots. I'm not very familiar with that one, but I think that's one that we can probably look into. So thank you for that question from the audience. So that was perfect timing about CIT. Tercusia, how many graduates were in the class yesterday from Iredell County? It slips me. Or if someone else can remember.
Amber, do you know Pam? 24. Pam says it was 24.
24. And wow, we could really get into a full conversation about CIT for sure, and the collaborative effort that is. But I know I'm kind of watching the agenda, Tercusia, and we need to move to our next person. But Tercusia, that was just again a treasure trove of information you shared, and we'll have some time at the end again after we do have our next speaker to open things up a bit more for questions from the group. But thank you so much for sharing what you're doing with the community and in your work with Statesville Police Department. And for folks listening in that are either, again, considering getting involved in some type of coalition building, you can start to see the trajectory of this and how many moving pieces there are to get it rolling, and the effort and energy that it takes. It's challenging and difficult. I like how Tercusia framed it up at the beginning. She said it's frustrating and it's really hard, but in a good way. So I think that's all of our work could be characterized that way, Tercusia. So I'm going to write that down and give you credit for that quote. So thank you so much, Tercusia, and I'm sure you'll have more questions from the group in a minute. So Jerry, do you want to get us set for the next person.
Sure, and Tercusia did not mention that she also will be soon stepping into the role of chairing the Iredell Collaborative. So really looking at adding to that, and actually our co-chair is on the call as well. So really happy to see those people involved. So really looking forward to the future of that. So our last person we're speaking, I've known for a few years, is Brett Eckerman, and I'll let him introduce himself. And welcome, Brett.
Thank you, Jerry, and good morning, everyone. This is a case of last is least, so it goes against the old axiom a little bit, but hopefully can continue some of the valuable information that we've heard from these other folks. I have the privilege of serving as the director of the United Way of Iredell County, been here 9 years, been in the United Way system for 17, started in nonprofits at the age of 13 as a counselor in training at my local YMCA. So have been involved with nonprofit and service-oriented organizations for an awful long time. This last year was a defining year for me professionally. It changed a lot of the way we operate, not just for us, but for most organizations in some way, shape, or form. One thing a lot of folks don't know about United Way is that we are a herd of cats. People think of United Way and they think of a monolithic global organization, and we are a very large nonprofit network, but each United Way is locally governed and directed. And so there's certain levels of standards around transparency of donor dollars and how we get audited and all that kind of stuff. But all the decisions about where money goes and what areas need to be focused in on by a local United Way are made at the local level. And as we had to redefine ourselves probably 4 or 5 times this year in response to COVID and what's been going on, we've found ourselves having to work at very different geographic levels to be effective at achieving mission. And I wanted to share just a little bit about that. So in March 2020, our United Way basically became a disaster response organization, which is a role we have not played traditionally in our community. But the need was there. We were nimble, and we had a relationship network that was able to mobilize quickly to get resources on the ground. So we partnered on the governance and resource development side with the United Way of Central Carolinas out of Charlotte, with Foundation for the Carolinas. And together we raised about $550,000 for Iredell County nonprofits focused around basic needs. So we're talking food, shelter, access to health care, ways to get people through these early days of the pandemic and all the craziness that was going on during that time. As we came around the corner a little bit and some of the federal dollars really started to trickle down around that, our local community action agency received a big grant to help with rent utilities. The HOPE program opened up and several other sources of that kind of funding. We shifted focus to really work on what's going on with kids in our community. Kids were doing remote schooling in Iredell County at that time, and parents were having to get out of work in order to do child care. There was a lack of connection to the internet in several places in our community that was keep leading kids out of that system. And there was the whole disruption in social network that was leading to a breakdown of a lot of the supportive systems that help children with mental and physical health, especially in families that have had some history of substance use and abuse and abuse, physical abuse. And so we had a whole new set of partners that we mobilized to do that. We were able to work with Iredell County, countywide. We worked with our local school system very heavily in achieving those goals. And we were able to drive about $300,000 into protective and supportive programming for kids. And that took mobilizing with the faith community. It took mobilizing with our local legislative folks up in Raleigh to figure out what does school licensure and childcare licensure mean during a pandemic, and how do we function in that reality, and all the different pieces that pulled us into a whole nother set of relationships. We also looped back with some of the EFSP dollars and with some very localized CARES Act funding that became available to do some basic need support with a group of partners strictly around utility within the city of Statesville. And so here we're ranging from working at a national or international level with some of these big corporate sponsors who drove some of the resources that made this local work possible, to working at a regional level with Charlotte and with others to mobilize some of those resources in our community, to being so hyper local that we were trusted by the city council in our local district to be able to provide a place where those resources could get used in our community quickly and efficiently. So the results of all of that is that we gave out more in grants since March 2020 than we have ever given out in our 65-year history, over $1.5 million, which is more than double the amount we traditionally will give out in a year. And that we worked with 45 local nonprofits in achieving mission goals in our community, serving over 110,000 folks, all told. All of those are significantly above normal operating levels for us. A couple of lessons learned in that for me was so many times when we think of coalition building, we think of transactional nature conversations. Who do I know that I need something from? And I'm going to go out and coalition build with them. We had a network of relationships in place that had been built over decades and decades of work that enabled us to move really nimbly because it wasn't just transactionally focused. We were able to pull the right partners around the table to do some very different things that are outside of our normal operations because that structure was already in place. And so I'm dedicating more of my time to building relationships, even if I don't have an end goal in sight right in the near future, because I know the asset that those can be as situations change and circumstances arise.
Brett, thank you so much for that. And, you know, as we're kind of nearing the end of this section, before we move into the Q&A, from a partner's perspective, and Jerry may want to chime in on this as well, or others from the partners community, what Brett said about kind of not having those longitudinal relationships, longer term relationships, where it's not so transactional at that moment, you know, where I need this, I need to go to this person, but having something established for a good while beforehand. I guess what Brett's really making me take stock in the fact that relationship building and being sincere with it is such a vital role in that, and to go ahead and start doing that as soon as you can, even if you're considering doing something, make that network and get involved. But Jerry, could you maybe tie in how the community collaboratives work within what Brett was just discussing?
Sure, and I'm going to lead with a recent example that I just thought was a powerful kind of introduction to just how the collaborative works for the community and to help. And we recently, and some of you will laugh because I've told this story to those that are on the collaborative, but we recently had something that seems simple to some of us, had a request for a cell phone, and seems pretty simple. But if you're a family that's struggling, you've got a child in intense services, that there's an intense need there that you need help with. So obviously Jerry can't answer that on his own. I just don't have the resources or capacity. But the person reached out to me, and they are a local provider, and sent the email to me. So my initial move was to turn around and send that to that collaborative in that county. Within about an hour, and I'd given direction, you know, include myself and the lead person. And within about an hour and a half or so, we probably had 15 different responses to try to help serve that person. And we've gotten several since then. And the very next morning, the person picked up the phone and had several options in terms of supporting that family that was in need. And I know that's a microscopic look at community collaboration and coalition building, but if you drill down or go up, that is what this is about. It's about when there is a need, whether it's a small need, such as a cell phone, or a bigger need, which what Brett, Mark, and Tercusia and Jessica have spoken about, you know, that's what we're talking about here. And the collaborative plays a pretty important role at pulling together those pieces and connecting the dots. And, you know, as my role with partners is to facilitate the Surrey, Yadkin, and Iredell collaboratives. And I've been very proud to see them grow and increase and really respond to the community at large needs and be a support. So hope that gives a microcosmic look at it. And I don't even know if I said the word right, but I hope that gives a good look at what partners' role from the collaborative is. It really is to do what each of our speakers said, is connect those dots and pull the community together to, when there's a need, to look at it. And I mean, I've seen a lot of growth in that in each of the counties I support and across partners.
Well, thank you, Jerry, for that. And I think that's a really nice way to put a bow on this, because we really have. We've looked at it from the macro level, you know, the big picture. And then Jerry just gave us an example of how that type of work, you know, it can move systems, but it can also make a difference in the life of a person or a family. And that's what we're all here to do. So in the little bit of time that I've had between sections, I've had a chance to just survey the attendees. And I have to say, this is a group today with the 49 participants that are on this call. We have people that range in work from early childhood all the way through the lifespan. You know, we have folks here from law enforcement, we have folks from the community, we have folks from partners, we have folks from not-for-profits, we have representation of our juvenile crime prevention councils, the providers that provide services for those youth. And I could keep going and going and going. I don't want to leave anybody out, but I certainly would. But my point is, I recognize the names and I recognize many of the organizations. And one of the things I can say about many of the people on here who have been successful is they're servant leaders. They're humble people, like Brett, how he introduced himself. They do the work and they show up in meetings a lot of times when you ask them to be there, where there may not be at that moment a particular reason why their organization may need to be at that table, but they show up to learn about that and see how can we maybe assist with this, and again, connect those dots. So thank you all for being participants today. And so now's the opportunity. You can either put your questions in the chat and Jerry and I can help facilitate those, or if you so choose, feel free to unmute yourself and ask our guest questions live. So I'll stop there.
Jeff, I wanted to ask, since we're waiting on questions, I wanted to ask if Tercusia would speak briefly about what they've done recently with the homelessness population in Statesville area, because I thought that was a pretty dynamic thing to come out of the police department and all the people involved. So if she would speak briefly to that, I would appreciate it.
Sure, no problem. And everyone knows, I mean, you know, you have individuals who are displaced without homes at different times. And so a lot of times law enforcement gets involved because they're trespassing, loitering, panhandling, or something. And so the police department was seeing, and specifically one of the captains of the districts was seeing that there were a lot of, you know, trespassing calls on individuals who just happen to be homeless. So looking at that, we have a bigger problem, a bigger issue. So he reached out for assistance, and I will say Pam Navy's on here, but she actually coordinated that effort to bring together a group of people that pretty much includes anybody that you could think of, individual members of the community, faith organizations, nonprofits, service providers. We have input from the hospitals, the school system. I mean, you name it, is within this collaborative. And we're looking at not only, you know, the acute issues, but the chronic issues and how to address that. And we don't have all the answers in that particular group. If we did, then it would have been solved years ago. But we're working together, and that's just an example where, you know, it started out and it was maybe 10, 12 people in the beginning, and now it might be 40 or 50 that are involved. And this is a network of people that are actually out and available. We have community members that have committed that they will go above and beyond to assist in the needs. And so if it's transportation from Statesville to Charlotte, they actually come, they pick up the people, take them where they need to go. So it you know, it helps. It really helps to stay connected, to be connected. And Pam, I don't know if you want to add anything. I don't want to take up all the time. She may want to add something to it.
Thanks, Keisha. Thanks, Jerry, for mentioning that. Yeah, I just want to shout out to all the partners. I mean, we've dealt with partners, helped on it. You know, Tina Willis has helped us. We had an event at the Cove Church where we had like 24 community partners there. We served over 40 homeless folks that day. Just today, I have been on the phone for over 3 hours since 7 o'clock this morning, guys. I had some text while this meeting was going on 3 homeless issues right now, and with the captains and with volunteers who are taking care of some issues. We got a little report yesterday at CIT that, you know, in the last like 8 or 9 months, that the community partners have assisted in getting 9 of the homeless population off the streets of Statesville and away to treatment facilities or substance use treatment facilities in other areas. So, you know, it was a great opportunity. It is still actively going. I will tell you that it is the most active boots on the ground that I have seen in a while, because there's daily talking to probation, there's daily talking to the hospital, to the mental health folks, to the substance use disorder folks. It is daily to the faith partners. It is daily, and then we get calls daily for the police department to respond. So we do have a list of volunteers that will come on and respond. So thank you, Jerry, for that, and let us know if we can be of assistance. And I will see that I get you that list, Jerry, to share of the folks that deal specifically with the homelessness population.
Thank you so much. And folks, we're at 10:55, which is our wind down time. So again, we want to thank everybody for their participation. Thank our panelists for being willing to do this and to share this is just fantastic information. Email addresses for myself and Jerry are in the chat. So please feel free to reach out to us after this. I know we can't cover everything, and not everybody wants to participate in a chat or go live on something, and we get that. So please reach out later. And Abby Cole wanted to just let folks know what's coming up next with our community cafe next month. But Jerry and I did want to say in closing that if this is something that folks are interested in and would like to go, this was an introduction to coalition building and collaboration. But if folks would like to go deeper into that to learn more, please reach out to us and let us know if you'd like to have some follow-up to this, because we'd like to continue the conversation. So thank you, and turn it over to you, Abby.
Thanks, Jeff. So next month, the Community Cafe, which is the 4th Wednesday of the month, same time, 10 to 11. The topic next month is going to be understanding Alzheimer's. and we'll have representatives from our gas team speaking that month. So if you're on the email list for this today, you can sign up to get more of those notifications for that. And if you're interested in receiving a recording of this, just email Jeff or Jerry and we can get that information to you guys.
Thank you so much, Abby. And again, being respectful of everybody's time. We hope you all have a great day, and thank you so much for participating in our community cafe today, and have a great rest of your week. Thank you so much.
Thanks, everyone. Bye-bye.
Love you, Miss Shirley.